everyone. Today we'll be speaking to a very well-known and experienced figure in the field of public health, Dr. Subhadra Menon. Thank you for being here.
Thank you for having me.
As someone with over 3 decades of experience in the field of public health communication, she has played a very key role in establishing communication, advocacy, and behavior change at the focus of all public health action. Today we'll be going over some of these areas, the importance of communication in health, and her journey over the years. So to begin with, communication and health are not usually associated with each other. Health is seen as a very medical thing, and it doesn't have a lot of emphasis on communication when it comes to action. So what do you think is the role of communication, and do you think this aspect is something that students can follow during their career paths?
Absolutely. In fact, I think we are fortunate that we may have started several decades ago with this disconnection between communication and health, and how do you achieve health outcomes using communication, or how do you use communication to at least improve health outcomes. So while I would say we lost several years in our effort because of this lack of connection, as you rightly said. At least now we are in a space where we are able to formally define and having created this kind of a discipline, which is, it can be called health communication, some people call it health promotion. But essentially, we have reached that point in the inquiry into public health as a discipline, knowing that unless we study communication and the role that communication plays in just catalyzing behavior change towards health-seeking or health-seeking actions, I think we've got there. We've gone to that point now. Now, of course, the challenge is for more and more institutions that work on public health to actually acknowledge that yes, this discipline exists and this connection exists.
Right. So during your career so far, are there any field experiences that you'd like to share as part of, evidence that communication has been a very important role of campaigns that have implemented some behavior change in health practices?
Mm-hmm. There are so many, I wouldn't even know where to start. But, just to share that the power of communication, even generally, even looking beyond health, just in society, is so strong that all of us know the role that it plays. So, obviously, I've been in several infinite experiences where you see the power of what good health communication can do. You also see the negative impact of lack of communication, or a lack of interest or a certain apathy towards communication as a science and an art that can influence public health outcomes. One example that stands out for me, and I'd like to share that, is a national mental health campaign that we had run when I used to be with the Public Health Foundation of India. And the reason this stands out in my experiences is that, we really worked hard to try and unpack the kind of excruciating stigma and silence that exists around mental illness. And we got this opportunity because one of our most visionary health bureaucrats in this country, who is unfortunately no longer with us, Mr. Keshan Desiraju, he was foresighted enough to give us this opportunity to work on the rejuvenation of the National Mental Health Program, but from the angle of communication. And we did multiple things in that project. We worked with young student artists and universities. We worked with experts who would bring that expert voice around mental health, which is so much needed. We also worked with NGOs and several other, stakeholders to say that in order to break the stigma and silence around mental illness, you need this multi-basket kind of approach. You have to have several tools that you will use and ensure that each one takes you closer to at least opening up and communicating on mental health. And it was quite a powerful experience for us because we used so many different kinds of mediums, right from, like I said, right from fine arts to the performing arts to experts giving talks to having nukkad nataks in the feed. And we found that, truly, if that sort of, it was a pilot study, if that sort of effort can be scaled up in a country like ours, maybe we would be in a very different place when it comes to mental health.
Speaking of PHFI, Dr. Menon was the Director of Health Communication for over 8 years. So during this period, a lot of technological advancements occurred. So how did you and your team accommodate these changes into the ongoing campaigns?
That's a very, very important question. Because for those of us who work in communication research and communication initiatives, one of the most important tools is to stay, at pace with the kind of changes that keep happening. For instance, Nidhi, that, we have discussed how we live right now in an infodemic. We live at a time when information is coming to us from so many quarters. And how do we deal with that information? What do we do with it? How do I act as an individual or as part of a community? It's very, very variable and very sometimes even unpredictable. So most certainly in the time that I was at PHFI, our team had an opportunity to work on multiple initiatives, some which were what we had ourselves thought through on. Some were working with funders and donors who were keen on investing in health communication. And the only way to keep pace with technological advances in the field of communication was to ensure that either we skilled ourselves up and kept ourselves abreast of all of these advances, or worked with experts who were already in those fields. So, and of course, at that time it wasn't so relevant, but today, what I would like to say is take social media platforms for instance. Powerful media to use for change. But do we know enough about it? Do you and I have the skills, the capacity, the bandwidth to actually utilize something like that? I would say no. We need to always, keep ourselves updated and upgraded in a sense in terms of our skills. And that's what we kept doing there. And at PHFI, our belief also was then to ensure that we worked with the right partners. So then you're able to bring in multiple skills. And that's how we coped with it.
So coming to your role here within the School of Public Health, what made you consider being an adjunct faculty with us at the School of Public Health at D.Y. Patil Dingleby University?
Thank you for that question. It gives me the opportunity to also thank all of you, thank Dr. Subhadra and colleagues for this opportunity. And the reason I say that is that, I feel health communication is best taught by active practitioners in the field. It's not purely just an academic, theoretical subdiscipline of public health. It relies a lot on what happens in the field, what happens in the community, what happens when you put out a campaign and, you see the results of that campaign or even the lack of results. So that's what becomes your learning ground. And the reason I responded positively to this opportunity, I would say there's more than one reason. One is that Dr. Nair and I go back a long way, and we have, if not actively collaborated, then at least been together at several sessions where we explored the same concepts together, whether it was in earlier institutions where we met, or even out of our mutual interest in the subject. The other reason that I believe adjunct faculty have a really strong role to play in this is, like I said, we need practitioners from the field to teach the subject. If you only teach, then you have lost that connect with the field per se. So that's why I feel that these opportunities are very, very important. They're also very useful for our students because then they get, exposure to what is actually happening in the field of communication or campaigns or health promotion. And another reason why I find my teaching experiences at DY Patil very, very in-depth and very pleasant and very, very useful for me also is that, there is the freedom to explore. So we are able to look at a larger issue and say that, okay, this would be the best way to teach it. Because unless we're open to these teaching techniques and what we need to use as material, what is it that we need to use as examples or illustrative resources for our students, unless we do that, it won't be a rich program. So I find that openness very welcoming, and that's why I'm here.
And thank you so much for this conversation with us. And do stay tuned to our channel for more updates at the School of Public Health. And thank you.